and it is such a pleasure to see each of you here today to officially launch the construction of a brand new state-of-the-art Pediatric Emergency Center at USA Health Children's and Women's Hospital. I had the privilege of working on the acquisition of the HCA Doctors Hospital by USA in 1990. So please bear with me as I take a quick walk down memory lane. The original Doctors Hospital did not have an emergency room. When USA acquired Doctors Hospital and established a freestanding children's and women's hospital, one of only 5 in the country, USA converted old surgical ICU space into what was called the Evaluation Center. While the space was never intended to be an emergency room, it became one, providing outstanding emergency care to our sickest and most vulnerable pediatric patients by an outstanding team of physicians, nurses, and healthcare professionals. Today is a day of celebration as we break ground on a state-of-the-art emergency center that is family and patient-centered and mirrors the outstanding care provided by our emergency room team. Through the generosity of our friends and support of so many, our healthcare team will now have an emergency center that matches the incredible care they deliver to every child who walks through the doors. This project would not be possible without the support of so many special friends to USA Health. These friends have believed in the hospital and the need for a new pediatric emergency center for a very long time. There are a few special friends that I want to acknowledge today. Without their commitment, the children of our region would not have this beautiful center. Mrs. Arlene Mitchell. Arlene has rocked babies in the neonatal intensive care unit. She has served on the Development Council. She is the vice president of our board of trustees at the university, and she cares deeply about all things USA and USA Health. I also want to recognize her family, Joy Grodnick and husband Jimmy, and her granddaughter Abby and Cliff Kennedy, who are here today. They are all ambassadors of this hospital and have worked tirelessly to advance the critical missions of this hospital. Martha and Kenny Muscat, who have believed in this hospital for a very long time, including naming the beautiful gift shop years ago in memory of Kenny's mother, Agnes W. Muscat. They continue to support and believe in what this Pediatric Emergency Center will do for our region. Thank you. Daphne and Alan Fondy, who have a heart for good and care deeply about children. They started supporting this hospital years ago when they heard a radiothon for the Children's Miracle Network and made a phone call to make support. And they have believed in this pediatric center as well for many, many years. And Daphne's mom, Dr. Grace Pilot, who gives back in so many ways to make a difference, both personally and through Pilot Catastrophe. She leads by example. Thank you, Dr. Grace Pilot. The Beard family, including Melissa and Brad Beard, Kristen and Drew Delaney, and Brooke and John Dodson. Beard Equipment has supported USA Health, Children's and Women's Hospital, and the Mitchell Cancer Institute through their Pink Tractor campaign, and Kristen and Brooke have been integral to local goodness and to our development council here. Thank you so much. The Porch Creek Band of Indians, represented by Mr. Robbie McGee. We are so fortunate for their continued support of all that we do at USA Health and the University of South Alabama. Thank you. We are also so grateful to Governor Ivey and the state of Alabama for support, as well as governmental leaders at all levels. Today we have with us Senator Arthur Orr, Senator Greg Albritton, Senator Jack Williams, Senator Chris Elliott, and Senator David Sessions. Thank you all so much. I also want to recognize members of the Alabama House, including Representative Barbara Drummond and Representative Adeline Clark. Thank you so much for being here. Further, I want to welcome from the board of the University of South Alabama, in addition to Mrs. Arlene Mitchell, Chairman of the board, Mr. Jimmy Schumacher, the Honorable Mike Wyndham, Ms. Chandra Brown Stewart, and Abe Mitchell, Honorary Trustee. Thank you all. And a special thanks to Dr. John Smith, Interim President of the University, and Dr. John Maramont, Vice President of Medical Affairs and Dean of the College of Medicine. Their tireless work to make this happen doesn't go unnoticed. It is why we are here today. Thank you both so much. I want to recognize Liz Freeman, Chair of the USA Health Children's and Women's Development Council, for her tireless work, and for the USA Foundation for all their support. Collectively, through the support of so many, we have raised over $13.5 million for this project that will make the Emergency Center a reality. So on behalf of the University of South Alabama and USA Health, my heartfelt thanks. At this time, I am pleased to introduce my dear friend and colleague, Mr. Owen Bailey, Chief Executive Officer of USA Health.
Thank you, Margaret. Wow, we're so blessed to have Margaret on this team. I don't know what we would do without Margaret and Kelly and their team. They're just fantastic. Thank you so much, Margaret. You know, this is such a special place. This is a place where miracles happen. I see a lot of the staff standing out there. I want to thank them, the team at Children's and Women's, and what they do. It's just so amazing. You know, some of my best memories and experiences of my time with USA were the 5 years or so that I spent as the administrator of Children's and Women's. And it is really an amazing place. You know, like Miss Mitchell, my mother rocked those babies every week, and she would generally, after she finished rocking, come to my office and say, here's a few things you need to work on at the hospital. So that was, our volunteers are just so important to us, and I experience that every week on behalf of my mom. So anyway, thank you all. And as I look at the folks here, volunteers, employees, team members, elected officials, I mean, this does feel like a family, and I think given the importance of what happens here, how important this is to the entire region, your support of this hospital and the rest of USA Health, it's just so critical, and we could not do it without you. So I hope you know we consider you family, and I think it's a special family. You know, I think you all helped us get to this point. We've talked about this expansion for a long time, and it is so needed, and it is going to make a great impact on children throughout the region. And I really look forward to the day down the road where we can come back and cut the ribbon on this fine facility. You know, I have said as I started, this is a place where miracles happen. It's probably most every week I get stopped by someone who has had some experience at this hospital and how their lives were touched. To put it in context too, though, the expansion of this emergency center is part of a very significant effort of expansion we've had at USA Health over the last few years. So I just want to highlight a few of the things that we've had happen and are coming online during this period of incredible growth. We've gone from about 7 care delivery sites 5 years ago to really now probably well up over 20 delivery sites in the region, and that has created access points into our system that weren't there before. A lot of new partnerships in the community, a lot of new providers coming on board. And let me just highlight a few of the projects that I'm talking about. We built the Mitchell Cancer Institute Fairhope facility and the Midtown Clinic, which is not far from here. We just opened an OBGYN office over on Old Shell Road. We've increased the capacity at University Hospital by converting the 11th and 10th floors to over 60 new beds, which are badly needed. We opened the Fannie Meisler Trauma Center in January, and it was full on day one. In a couple of months from now, we'll open a freestanding emergency department out in West Mobile that'll also be home to a full complement of imaging technology. There will also be a professional office building built adjacent to that freestanding emergency department on Hillcrest Road. We also understand the need for more healthcare to be provided in Baldwin County, and we already have several locations in Baldwin County. Next week, we'll have another groundbreaking on the Mapp family campus, which will be home to a physician office building, which will also have that full array of imaging, and also an ambulatory surgery center. We're also opening an OBGYN office in Spanish Fort, and we'll be expanding the Mitchell Cancer Institute in Fairhope, which is also a much needed expansion, including parking, and also an expansion of the Mitchell Cancer Institute down in Foley. There are a number of other facilities I could mention, but just that list alone, I think, gives you a picture of how our expansion has been happening, and that is very important when you consider that we are the only academic health system in this region of the Upper Gulf Coast. And we have a very important mission that we take very seriously of not just providing the clinical care, but also the education component and the research component. Now, I just ran through a list of buildings and facilities, but my team and I always like to bring us back and remind ourselves those are buildings and they're very important. What's really important, though, is the people in the buildings, the patients and their families, our caregivers, the educators, the researchers, our volunteers. Is a critical mission, and we represent something that is unlike anything else in the region. So I want to thank you all for helping us meet that mission. And as we move forward from here, we will continue to have that focus on serving. And we're here to serve this region. And we have that academic calling which drives us every day. So I want to just close by thanking you all again for what you do. This is a great and very exciting day. It's going to make an impact on children and families for many miles around here. The staff, again, you are very special. Thank you for what you do. I will say, in closing, a comment about our staff and how well they've handled the COVID challenges. That has been something very impactful on every healthcare provider. And I just want to brag on our team and the way they've handled that and the stresses that have come with that. And I'm thankful to be a part of this incredible team. So congratulations to everyone for this great day. And it's now my honor to be able to turn this over to the administrator who worked so hard in leading this team here. And Chris, we thank you for all your work. This is Chris Jett. Thank you all very much.
Thank you. And I am honored to be able to share a few thoughts about the project and a few of the details. First, I want to thank USA Health and the university for committing to this project and understanding the need. I want to also thank the donors. As we've talked about this over the years, it's the donors who have really grasped the vision and pushed the vision and in some ways led the vision to execute on this. I know that this event is a lot about you, but I don't think we can overstate your contribution to this and how we've achieved this. And the third, Owen mentioned our staff, and I just want to say thank you to our staff who have built really an institution and a way of providing care that we can build on and makes this a possibility, and makes this something that's achievable and something that the community will desire. And so we have many of our staff here. Could I ask that we give a round of applause to our staff? Thank you all for your service. So Margaret kind of did a good job of describing the need and where we're coming from, and I think most of you here know where we are currently in our facility. This new facility will rectify many, if not all, of the issues that we are currently experiencing with an old and outdated facility. We are going to over double the size of the space. We're going to go from around 9,000 to 19,000 square feet in our new ER. The treatment spaces, we have 14 currently, and we're going to go to 30 treatment spaces in the new ER. And these treatment spaces are going to be built and dedicated for the types of patients that we treat. We will have dedicated behavioral health rooms, which unfortunately we have a greater need for at this state, and we will have space dedicated to them that is safe for those patients. We'll have isolation rooms for infectious patients where they are able to be treated. We will have major medical rooms for traumatic injuries that present to our hospital. We'll have space that is adequately equipped and adequately sized for those patients. We'll have sensory rooms for pediatric patients who need, we talk about distraction therapy a lot here and how kids benefit from distraction therapy. We will have rooms equipped that will distract patients and engage them while they're here receiving treatment. But there will be many other benefits with the design of this facility. We'll have a bereavement room for patients and families who experience loss. They will have a place to get away and deal with those concerns. We will have consultation rooms when we need to pull parents out and talk to them about the care that they are receiving or their child is receiving. We'll have a waiting and triage area that's actually in the unit and not across the hall that can be located there. We'll have teaching space to support residents and medical students and nursing students who as we're training the future for this community. So given all that, why is it important? I think most of us know that we are the only facility providing 24/7, 365 pediatric emergency care in this community. We're providing it with our pediatric emergency medicine doctors. We're providing it with our pediatric emergency medicine trained staff. And we're providing it with a children's hospital there to support that emergency center that has pediatric specialists, that has child life therapy, that has unique things that aren't found anywhere else in the community. So this facility will be an entry point for nearly 40,000 people a year, and I expect that that number will grow greatly whenever we open this new facility and we have capacity to see these patients. And it'll help us provide the care that these families expect when they come, but that they deserve when they come. And so we're very excited. Those of you that have been intimately involved with it, I know that you're excited as well. We'll be sharing photos, we'll be sharing floor plans, and we'll be moving very quickly on this project. So as Owen mentioned, though, it's more than just the building, and that's what we're here to celebrate, but there's much more to it, and the care that is provided in the building is really what is exceptional. And so I'd like to ask Dr. Ed Panachek, who's our chair of emergency medicine, to come share a little bit about the vision for what we plan to achieve in that arena. Thank you.
Thank you, Chris. You know, all of us care very deeply about our children. And all of us want really only the very best things for them. And that includes their medical care. In 2016, we had a national expert in pediatric emergency care do a consultation and analyze the state of pediatric emergency care in Mobile, and specifically here at the Children's and Women's Hospital. And the report that we got back was not very flattering. It pointed out that we were nowhere near national expectations and standards when it came to pediatric emergency care. And it pointed out that we could and certainly should do better, if not very better. We took that report very seriously. We took it to heart. We set the goal at that time of fixing that issue and fixing things. The report outlined 3 general categories of recommendations. One of them had to do with expertise and qualifications of our medical staff. The second one had to do with emergency preparedness. And the third one had to do with the facility itself, which they pointed out was never designed to really be an emergency department and certainly didn't meet national standards in terms of what you expect of emergency departments in general, better yet, ones designed for children. So we sat down and we developed a game plan to look through all that. Regarding the expertise of the practitioners, the gold standard in pediatric emergency care in the United States is to have a core group of physicians that are board certified in pediatric emergency medicine. In 2017, there was not a single board certified pediatric emergency medicine physician in the entire city of Mobile and the entire region. Not one, 0. So we started a recruitment process, and we were very fortunate in 2018 to attract and be able to bring on board our first, and at that time, the only in Mobile, board certified pediatric emergency medicine physician. And that person is here with us today. It's Dr. Larry Mellick, standing there on the side. And when I say we were not just fortunate, but we were very fortunate, is that Dr. Mellick isn't just board certified in pediatric emergency medicine, he is recognized as a true national expert authority on pediatric emergency care, who has developed multiple previous pediatric emergency departments on his own and developed multiple pediatric emergency medicine fellowship training programs on his own. So a real leader in the specialty going back for decades. And since then, we have brought on multiple other pediatric emergency medicine board-certified physicians, and there are more to come. Let me point out that as we sit here today in 2021, there still is not another hospital, there is not another emergency department in our entire region that has a single pediatric emergency medicine board-certified physician in it. 100% of all of those highly qualified gold standard physicians for pediatric emergency care are right here working in this building right here behind us. The second issue that was brought out was that we were not adequately prepared for pediatric emergency care. There are national documents on this that have checklists. It's called the Emergency Department Preparedness for Children guidelines, etc. In 2018, there was not a single hospital in Mobile, including this one. There was not a single emergency department in this entire region that met that national established criteria for being fully prepared for pediatric emergencies. At that time, Dr. Mellick was with us, and he assembled his team, and together with excellent nursing leadership, some of whom I see in the back of our crowd here today, and with the very strong support of hospital administration, they set about fixing that and accumulating all the specialized equipment, specialized medical instruments, specialized medications, specialized supplies that you have to meet the national standards for what an emergency department must have to be adequately prepared for the full range of pediatric emergency patients. I'm happy to say that as we sit here today in 2021, this hospital, Children's and Women's Hospital, is now fully compliant with that and has all of those supplies and specialized equipment in place through the hard work of all those individuals. Let me also point out that there is no other hospital in Mobile, there is no other emergency department in this entire region that meets those same criteria, that has all of those supplies in place and meets the national standards for emergency department preparedness for children. Not one. And if you have a child who gets suddenly or severely ill, I think that's important information to know that in this entire region, there is only one institution, one emergency department that has those gold standard qualified physicians and is fully prepared with the necessary equipment, supplies, etc., to be able to meet those requirements. The third thing that they addressed in the report and criticized us for was the inadequacy of our facility, that we didn't have a real emergency department set up the way they're supposed to be. Well, the fact that we're all sitting here today at a groundbreaking ceremony means we all know that that's about to change and that's about to get fixed.